Your PSA test might be lying to you. That's right. A normal PSA test does not always mean that you are in the clear. Please allow me to explain. My name is Dr. Ennin, doctorate pharmacist and a functional medicine doctor. And again, welcome to the channel. So what is PSA? PSA stands for Prostate-Specific Antigen, and it is a protein that is made by the prostate cells, and it's usually measured to screen for prostate cancer. But here's the issue. A single prostate number does not tell the full story. Why is that so? Because PSA can be elevated for a number of reasons, not just for cancer. Think of enlarged prostate, infection, and even recent sexual activity or exercise. And these are all things that can affect the prostate-specific antigen, or PSA for short. And there is another test called the PSA velocity, which is how quickly your PSA levels rises over time. If your prostate numbers are going between 0.35 to about 0.75 milligram per nanogram per year, it is indicative of a red flag. It could mean an aggressive form of prostate cancer is developing. And that is why men should track their PSA levels over years and not just one-time test. And there is another parameter, which is the PSA density, which really compares your PSA level to the size of your prostate, and is calculated by dividing your PSA by the volume of your prostate. So if the density is greater than 0.15 nanogram per ml per cubic meter, that's more suspicious of a cancer. Lower density, more likely to be something benign and not prostate enlargement. This helps avoid unnecessary biopsies and stress. Now, why does this matter? It matters because a man with a normal PSA but faster rising velocity, or a high PSA but low density, may have different risks. And that is why functional medicine uses trends and contests and not just snapshots. So now, what is the takeaway here? So these are some of the things you want to be asking your doctor. So what's my PSA trend over the past few years? Can we check my PSA density with imaging? Should we retest to track the velocity? It gives better data, better decisions, and less guesswork. So if you or someone you love and is over 40 years old and hasn't had a personalized prostate health assessment, now is the time. Schedule a virtual visit with me. Book a consult with me, and let's get proactive about your health. And this is another pearl of health wisdom. Please don't forget to like, follow, share, and most importantly, subscribe so that we can keep this conversation going. I will see you in the next video. Thank you.